Hi, thank you so much for having us today. We're excited to share a little bit about the development and evolution of the Milwaukee County Falls Prevention Coalition as part of this webinar series. My name is Susie Ryer, and I'm one of the co-leads for the Milwaukee County Falls Prevention Coalition.
Thanks, Susie. Hi, I'm Ann Gallo, and I am the other co-lead for the Milwaukee County Falls Prevention Coalition. So looking at what the problem is, the reason we're here is because falls is an epidemic. Wisconsin has the highest rate of fatal falls for older adults, actually 3 times higher than the national average, and Milwaukee County has the 9th highest emergency department rate for falls in Wisconsin. To address this, we need to take a public health approach to the complex issue of falls and increase health and community partner collaboration so we can bring tools and resources to those we serve. We identified the need to work upstream, so we pulled together key stakeholders, Aurora Healthcare, the Milwaukee County Department of Health and Human Services, and the Milwaukee Fire Department, and discussed the issues around falls: high fall rates, stigma, lack of collaboration between health systems and community orgs, lack of tracking of falls data, and the lack of knowledge and access to fall prevention screenings, programs, and resources. In order to close the gaps, we took the community public health strategy and brought together health systems, government agencies and departments, and community partners. So the Milwaukee County Falls Prevention Coalition was formed in 2019. In March, we held focus groups with community to leaders of those organizations that work with constituents around falls to identify fall prevention needs of their organizations and the patients that they serve in the community. From the focus groups, we actually formed a steering committee, and that was comprised of 13 members that included key organizations like health systems, the Department on Aging, health departments, fire departments, and experts within those like geriatricians, physical therapists, EMS, and trauma. Between April and September, we actually held community listening sessions to hear from community members and identify their needs. And then we worked with the steering committee that we identified to look back at the focus groups and the listening sessions and the learnings we had from those, any key themes to identify our mission, vision, and strategic plan to focus in on those identified areas of need, which were access, awareness, collaboration, member engagement, data and metrics, and education. Our kickoff was held in September 23rd of 2019, and we've been meeting monthly for an hour since then. And then we started to go virtual since COVID, and we've been meeting again monthly since then, and we hold about 3 to 4 meetings in person annually. So if you look at our key partners, all the local health systems, the county, public health, rehab facilities, home health, EMS, fire, even university programs. As you can see, Milwaukee County is abundant with active membership. We have over 30 organizations across these categories that consistently collaborate on fall prevention in Milwaukee County.
Thanks, Ann. So as we look at really how we went about developing these key partnerships, there's a lot of kind of key concepts to share. So as Ann shared, we had a lot of different organizations represented as part of our coalition. And that really started with, first of all, thinking outside of the box. When we had our first listening sessions, we really tried to think broadly about anyone who may impact the life of an older adult or have opportunities to connect as it relates to fall prevention strategies. And so when we were assembling our list of invitees, we really moved beyond just traditional healthcare partners or community organizations, and also tried to think about individuals working in different settings, those working in home improvement, to be able to have a really diverse representation, including older adults and their care partners as well. We found that when we were trying to develop these partnerships, it was really important to create a win-win for any of the organizations and individuals participating. So as part of our strategy to engage our members, we try to share the benefits that the organizations can get by being part of the coalition, whether that's access to tools and resources, opportunities to be highlighted in our membership guides or on our website, or providing them with opportunities to share new things going on as part of our monthly meetings. So really making sure that not only are they able to bring their clinical expertise to our coalition to help us move things forward, but to also see benefit back to their organization. We've really tried to leverage the network that we've built within our coalition to grow and add more members. So a really successful strategy we had about 1.5 years ago was to have a bring a friend to a meeting event. So during one of our in-person meetings at the start of the year, we encourage people to bring a friend or someone from another organization to the meeting to learn more about the coalition, to have an opportunity to engage. We've also tried to use the coalition partnerships as a way to collaborate on different initiatives, grants, projects that are happening in the community as a way to really build those relationships and partnerships, and also to bring maybe new organizations into the coalition. One example of that was working with our EMS departments on some work that they were doing around community fall prevention and being able to distribute some toolkits, which we'll talk about shortly. We've also tried to create a succession pipeline for our coalitions. So we identify that there's certain organizations that are particularly valuable to have at the table: EMS, health systems, representation from some of our local public health departments. And sometimes if someone leaves that organization, we want to make sure that they've identified a successor so that we don't lose contact with that particular organization. And then finally, we have just tried and tried again with some organizations that were maybe a little harder to bring to the table early on. So as Anna had shared, obviously we started our coalition back in 2019. So in the early years of the COVID-19 pandemic, it was hard from a bandwidth perspective to engage public health, some of the other healthcare and EMS organizations due to the kind of ever-evolving roles that they had at that time. And so we've tried to come back to those groups and thoughtfully think about who we want to extend an invite to each year to try to re-engage them in our work. One of the things that we really use to not only start our coalition, but to continue to drive us forward is a wide variety of data measures. And in looking at the literature, we really saw that with something like a coalition that's trying to move such a large public health issue of falls forward, it's important to have a lot of different measures. So we really look at 3 different categories of measures as part of our overall kind of record of success. So process measures that tell us how much work we're doing, how much involvement we have. And so that might include things such as how many coalition members we have, what our social media traffic looks like, or our website traffic looks like, to know kind of what engagements we're having. And then we count just about everything we do: how many toolkits we distribute, how many education sessions and individuals we educate, how many people attend the various community events that we do. And so that's really a way for us to measure kind of the level of involvement that our coalition has. We also measure some additional success in terms of how much awareness we're building in the community. And we've done some of that through, grants that we've obtained, invitations to be involved in other community work. And so that's another area that we measure. And then ultimately, we monitor quite a bit of falls data from a wide variety of sources, whether that's our EMS call volumes, whether it's the WISH database that allows us to look at things like injuries, death, and hospitalizations due to falls. But understanding that those come with a significant lag, and so sometimes it can take a little time to be able to look at those distal outcome measures. So as we wrap up our 6th year now of our coalition, hard to believe, a lot of successes that we can kind of highlight and celebrate. So some of the things that we've accomplished over the last several years have been developing a wide variety of fall prevention programs and resources to share with the community. That includes a resource guide, which allows individuals to know the best places or local places with free, reduced cost items such as home safety, community exercise programs, things like that. We've also developed a map of our fall prevention programs to allow us to better highlight where we have evidence-based fall prevention programs available, which has also helped us to identify where there's additional needs. One of the highlights is our fall prevention toolkit, which you'll see the kind of orange folder in the slide. And we've developed those and distributed over 6,000 over the last several years, as well as being able to translate those and have those available in Spanish. Each year we do community outreach as part of National Fall Prevention Week, and to date we've had about 600 participants over the 5 years of offering that we've had those outreach events. In addition, we've also focused on provider education, so educating our EMS providers as well as those in healthcare settings, as well as firefighters. We also took on a couple of initiatives to work with our medical students and residents at local colleges in order to be able to provide them with education on fall prevention screening and best practices. And as I mentioned previously, we also track our grant funding and have been lucky to receive and thankful to receive several different grant funding opportunities, both through a philanthropic donation to our organization, one of the LEAF grants that was offered through Wisconsin Institute for Healthy Aging, and then recently a federal grant through HRSA that is allowing us to continue to grow and expand some of our community fall prevention work, not only in Milwaukee County, but in surrounding counties as well. So some final thoughts as we think about starting a coalition and our journey to this point. And for those of you who may be thinking about starting a coalition, is first and foremost, it's really important to understand the unique needs of the community you serve when you're building your coalition. For us, it was really starting with that idea of a large unmet need around, community falls that were happening, that were bringing people to our emergency departments and overwhelming our EMS resources. And those initial conversations really highlighting a focus area on building collaborations, trying to better connect resources across the continuum of care. In your community, it may look a little different. Your data may point you in a little different direction for where the focus areas or the needs of your coalition would be. But really understanding that will help in setting the foundation for a successful coalition. And then the next piece is to really understand and support the coalition partners with their challenges. So not only understanding the broader community need, but knowing what it is that those who are coming to the coalition are looking for. Early on, I think we really identified that it was people wanting to gain resources that they could further share within their networks. And so that was part of where our early focus was on development of toolkits, educational content that were able to be shared a little farther into the community. And then finally, we all know that data talks. And so it's really important to leverage that data to collect as much data as you can to be able to show the impact, and then to also to use that data to understand where you may have additional needs. So as I mentioned before, looking at where there's gaps in offering evidence-based programs, or looking at areas within your community that might have higher levels of falls or EMS calls can really help to tailor and target your interventions to the right location. So with that, we want to thank you for giving us a little bit of your time and giving us the opportunity to speak, and encourage you to reach out to us either through our website or by contacting either one of us individually with any questions you may have.
Thank you.